Welcome to Have More Babies. Today we're jumping into a topic that affects, well, quite a lot of families, but often stays behind closed doors. We're talking about nighttime bedwetting in kids, and the medical term is enuresis. Our goal here is to really unpack it and make it less confusing using insights from a great source, Omega Pediatrics and their article, Enuresis, Demystifying Nighttime Bedwetting in Children. We want to give you some clarity, some helpful ways to think about this.
It really is fascinating, isn't it? How incredibly common this is, yet how much stress and confusion it can cause, which naturally leads you to ask, how can we best support kids and families going through this? And that's where our source, Omega Pediatrics, really helps. It gives a clear path to understanding not just what it is, but why it matters.
Okay, so let's get right into it then. Enuresis. Omega Pediatrics makes a really important point here. It's not just, the odd accident that happens to every kid. We're talking specifically about involuntary urination at night in kids who are technically old enough to have bladder control, say 5 or 6 years old usually. Yeah. And the key word they highlight is recurrent. It's a pattern, right? And recognizing that pattern is kind of the first step beyond beyond dealing with wet sheets. It impacts their emotional well-being too.
Right. Connecting this to the bigger picture, it's often not just one thing causing it, which can be surprising. Omega Pediatrics points out it's usually a mix of factors. It's less about fault and more about biology and development, like genetics, for instance. That plays a pretty big role. If a parent or maybe another close relative had issues with bedwetting, the child is actually statistically more likely to experience it too. It's not a guarantee, of course, but it suggests a hereditary link. Kind of a little clue from the family history.
That's really interesting. It takes away some of the pressure knowing it's often out of the child's control.
Yeah.
So besides genetics, what else adds to this complex picture?
Well, another very common factor is deep sleep. Some kids sleep incredibly deeply, so deeply that the feeling of a full bladder just doesn't wake them up. Their brain essentially isn't getting that signal strongly enough during sleep. Then there's what's called delayed bladder maturation. This doesn't mean the bladder is lazy or anything. It's more that the nerve pathways, the connection between the bladder and the brain signaling fullness during sleep, they're still developing. It's just on its own developmental schedule, basically. Needs a bit more time to fully connect.
Okay.
And we absolutely can't ignore emotional factors, things like stress, anxiety, or big life changes in new school, maybe a new baby in the house, even moving home. These can definitely trigger or worsen bedwetting. And it's often not just one of these things, It's frequently an interplay between several. Figuring out that specific mix for a child is really key to finding the right support.
All right, so if it's often a mix, how do parents start to figure out what's actually going on? Omega Pediatrics mentions that nighttime wetting isn't always the only sign, right? There can be other clues. So you need to look beyond just the wet bed in the morning, like maybe daytime accidents, even if the child seemed fully potty trained.
Precisely. That's a big one. Daytime accidents after a period of being dry can definitely signal something more is happening. And the source also points to things like frequent urination, where the child needs to go way more often than seems typical for their age, almost constantly sometimes, or maybe straining or showing discomfort when they do urinate. That's always something to pay attention to. These extra signs, they really help paint a fuller picture for parents and caregivers. It helps determine if, a proper medical check is needed. It's about looking at the whole pattern, not just the nights.
That makes sense. And that leads us to diagnosis, which Omega Pediatrics says is kind of a multi-step process, not just a quick look.
Exactly. A careful investigation is a good way to put it. The first and maybe most critical step is a thorough medical evaluation. This is absolutely fundamental because you need to rule out any underlying medical issues, things like UTIs, diabetes, maybe even kidney problems. You wouldn't want to miss the real root cause, and that's a really key insight from Omega Pediatrics.
Right.
Sometimes, if that initial check isn't clear, bladder tests might be needed. These give a more detailed look at how the bladder is actually functioning, its capacity, things like that. Really useful data. And importantly, if emotional factors seem like they might be a big part of it, then a psychological assessment could be really helpful. Understanding stress or anxiety is key. And this thoroughness is crucial, isn't it? Because it means the management plan can be tailored exactly to the cause. A generic approach just won't cut it if you haven't pinpointed the specific factors involved for that child. It makes treatment much more effective.
Okay, so once you have that better understanding, Omega Pediatrics talks about management strategies. And it sounds like it's about more than just stopping the wetting. It's about empowering the child, right? Supporting them, like positive reinforcement. That sounds really important. Not like huge rewards, but acknowledging the effort,
Mm-hmm.
celebrating dry nights, maybe with a sticker chart, or just praise,
Mm-hmm.
building their confidence, reducing that anxiety we talked about.
Absolutely. It shifts the focus from the problem to the progress, which
Yeah.
is huge for a child's mindset. And beyond positive reinforcement, Omega Pediatrics also discusses bladder training. These are specific exercises to help improve bladder control and capacity over time. Could be simple things like encouraging the child to wait a little longer before going during the day to gently stretch the bladder, or practicing stopping and starting the stream, things like that.
Hmm.
These exercises help strengthen the muscles and improve those brain-bladder signals. And yes, sometimes medication is an option. The source mentions desmopressin as one example. It helps reduce urine production at night, often used more for short-term situations, though, like sleepovers or camp, not usually a long-term fix. The main idea with all these strategies is working with the child, building their confidence and control.
That focus on empowerment is really key. And it ties into something else. Omega Pediatrics highlights the emotional side of this. It's not just physical, is it? Understanding the emotional impact is just as vital.
Oh, absolutely. The psychological toll can be really significant. Kids often feel incredibly embarrassed or ashamed or very anxious about it. This can hit their self-esteem hard, make them reluctant about sleepovers, social things. They might feel different, isolated, maybe even blame themselves, which is heartbreaking. This is exactly why that emotional support from parents and caregivers is so crucial. Creating a really supportive, understanding, non-judgmental space at home makes a world of difference. It helps them feel safe and reduces those feelings of shame or guilt. Focusing on effort, not accidents.
Yeah.
You have to address their emotional well-being alongside everything else. Their overall confidence and happiness is paramount.
That focus on the whole child, their well-being, brings us to probably the most reassuring point from Omega Pediatrics, which is that even though it feels like a big challenge right now, for most kids, this is something they simply outgrow. As they get older, as their bodies and nervous systems mature, that brain-bladder connection gets stronger, and nighttime dryness just happens naturally for most.
Yeah, there's always more to learn, isn't there? But sometimes the biggest lesson is just patience and providing that consistent, supportive environment while they develop. Natural maturation is a really powerful force here. For most kids, their bodies do figure it out. It just highlights why rushing it or using punishment is really counterproductive. Trusting their timeline while getting support when you need it, that's key. It's definitely a message of hope.
So wrapping this up, what does this all mean for you listening? Maybe it's just a reminder that even these common childhood hurdles, like enuresis, are chances for us to offer deeper understanding and compassion, to focus not just on fixing the immediate issue, but on nurturing the child's confidence and overall well-being as they navigate this stage. It's about patience, support, and creating that safe space for them to grow through it. And if you want to dive even deeper into this or explore other pediatric topics, we really recommend checking out omegapediatrics.com. They have a ton of great resources and information on their site, really comprehensive. Again, that's omegapediatrics.com. If you found this discussion helpful today, please do give this video a like, subscribe to our channel for more insights like this, and please share it with anyone else you think might find this information valuable. Thank you so much for joining us on Have More Babies for this look into understanding enuresis.
Yes, we really hope this conversation has given you some valuable knowledge and context.
Until next time, keep learning and stay informed.
Goodbye for now.